Pinpointing the source of lower back pain can be very challenging, which can be a frustrating process for the patient with lower back pain. Often they get multiple different opinions of what the cause of their back pain is. One cause of lower back pain is the iliolumbar ligament. It can be injured, damaged, and be a source of pain. Not all doctors are aware of this ligament, nor are all pain management doctors aware of this as a source of pain. Today I'm going to talk about how to diagnose the iliolumbar ligament as a source of pain. Before I diagnose this ligament as a source of pain, I need to be somewhat suspicious that this ligament is a problem. Patients will often have a story of a lifting injury that started their pain. It could have been a few months ago, it could have been years ago. This lower back pain is often worse with bending forward, often with sitting. The pain can also refer from the back down into the thigh, into the groin, or to the side of the hip. Patients with the iliolumbar ligament pain will often point to their source of their pain and place their thumb just on the inside and above the posterior superior iliac spine, or PSIS. And the pain can sometimes be reproduced by palpating or pushing on this area on the patient. Imaging like X-ray and MRI are helpful in the diagnosis of lower back pain. In this situation, we don't see the iliolumbar ligament on MRI or X-ray, so it's not super helpful. Sometimes we'll see someone with a normal lumbar spine MRI, which may indicate that a ligament may be more the source of the pain. So if the story is similar to this, then I'll move forward with looking to diagnose the iliolumbar ligament as the source of pain. I prefer to do this under X-ray guidance or using fluoroscopy. You can also use ultrasound guidance, which is a little bit more challenging as the ligament's a little bit deeper and not as easy to visualize as some other structures under ultrasound. So what I do is I advance the needle right into the ligament, right where it attaches to the bone, either on the iliac crest or over the transverse process of L4 and L5. And if that reproduces the pain as I'm putting that needle right into that ligament, then that confirms that as a source of pain. Often while I'm doing this, I'll inject an anesthetic like lidocaine into these attachment spots. That way, if the patient receives significant improvement in their pain, then they can feel reassured that this is the source of pain. So with this accurate diagnosis, then we can move forward with proper treatment, which would include things like physical therapy and often something like a regenerative treatment option, including platelet-rich plasma, where we inject that right into the ligament attachment sites. So if you're trying to find a doc that can do this, one thing to do is to look up doctors in the area that do treatments like prolotherapy. They'll often do this type of test or treatment on the iliolumbar ligament. Or feel free to stop by our practice if you're in the Oregon area. Until next time.